Welcome back. It's time now for Medical Moments with Covenant Healthcare. Today we're talking about fevers in children. With me here today is Dr. Tracy McComb with Covenant MedExpress. Thank you for joining us.
No problem.
Now, as cold and flu season gets underway, a lot of parents, they try these remedies to help heal their children. So what are some remedies that they should and should not try?
Well, we see a lot of people come in. Obviously, this is a very busy time of year, and we see a lot of people who come in not knowing exactly what to do. You know, is it fever? Dangerous situation? Is it not a dangerous situation? Is this something that really needs to be treated or not? We always recommend, of course, pushing fluids, getting rest. If the fever's pretty low grade, we usually recommend things like Tylenol or ibuprofen, but only if needed. I think people are really scared of fevers, and they don't really need to be. Fever is just a way of your body trying to treat itself.
Right.
And to a degree, usually about, 1 of 3 or so, it's actually helpful to have a little bit of a fever, but then people will try using other things to bring it down, and they don't necessarily need to. So we see people sometimes come in and they've done alcohol baths, or they've bundled the children up, or they've given aspirin, which of course is a big no-no. So we usually recommend, don't overbundle them. Make sure they're getting plenty of water, Tylenol or ibuprofen if they're uncomfortable. But they don't really need to worry as much about it as they think. The biggest question is always what's causing it.
That's good to know. Awesome. Now, at what age are children more susceptible and vulnerable to a fever?
We always worry the most when they're under about 6 to 8 weeks of age, because at that age they don't have any real immune system yet. After that, children can get pretty high fevers and still do pretty well, but of course we want to make sure that there's no underlying issues. Obviously, if they have a fever over usually about 100 in a newborn, we want them to go right into the ER.
Scary.
Very scary.
Speaking of that, when does a parent know when to go see a pediatrician if their child has a fever, or simply check out MedExpress?
Well, usually if it's a lower grade, it's okay even just to wait at home and treat those symptoms like I was talking about. Obviously, if there are other concerning issues, like the child's complaining of ear pain or throat pain, or they have trouble breathing, they're going to come in sooner. If a fever is over 103, it's always reasonable to call the pediatrician, and obviously if it's a weekend or something where they can't come in, then they come in. And if it's something where the child is very ill, they're going to want to get seen right away, and that's where we come in.
Awesome. Now, MedExpress also has a website that makes things a bit easier for parents. Tell us a little bit about that.
It's a wonderful system. You sign in online at the Covenant website, and then you can actually follow your wait times. It's a little bit like what Secretary of State uses, and it's very convenient because then when your appointment time is coming up, you just kind of head on in and let them know let us know you're here, and then we get you right back and get you seen, especially in a busy time of year like right now. It's a very nice thing to have. Yeah,
I've actually used it for the Secretary of State, and it's very helpful. So I imagine it's incredibly helpful when parents need to bring their kids.
Yeah, especially then you don't have your sick child sitting in a waiting room of other sick children.
Yes, awesome. Very helpful information. Thank you so much for being here with us today.
You're welcome. It's my pleasure. And stay healthy.
Yes, stay healthy. If you would like any additional information on today's topic, just head on over to the hot links page on WNEM.com.